The medieval period, spanning roughly from the 5th to the 15th centuries, presents a fascinating paradox when examining the relative dangers posed by different professions to public health and individual survival. While executioners have historically captured the imagination as symbols of death and violence, a careful analysis of medieval society reveals that barbers posed a significantly greater threat to the general population than those whose explicit role was to end lives. This counterintuitive reality emerges from an examination of the scope of practice, frequency of contact with the public, medical procedures performed, and the cumulative impact on mortality rates across medieval communities. Medieval barbers occupied a unique position in society that extended far beyond the simple cutting of hair. The barber-surgeon, as this profession became known, represented a convergence of cosmetic services, medical treatment, and surgical procedures that placed them in direct contact with virtually every segment of the population. Unlike executioners, whose interactions were limited to condemned criminals and occasional public spectacles, barbers serve as primary healthcare providers for the masses, treating ailments ranging from minor cuts to life-threatening conditions. This widespread accessibility and the trust placed in their abilities created opportunities for harm on a scale that executioners, despite their fearsome reputation, could never match. The foundation of the barber's danger to medieval society lay in the fundamental lack of medical knowledge and understanding of disease transmission that characterized the period. Medieval medicine remained heavily influenced by ancient Greek and Roman theories, particularly the concept of the four humors: blood, phlegm, yellow bile, and black bile, which were believed to govern human health. The imbalance of these humors was thought to cause illness, leading to treatments that often proved more harmful than beneficial. Barbers, operating under these flawed medical principles, routinely performed procedures that inadvertently spread disease, caused infections, and resulted in death rates far exceeding those attributable to executioners. The tools of the medieval barber represented another significant source of danger. Sharp razors, crude surgical instruments, and primitive bloodletting devices were often shared among multiple patients without any understanding of sterilization or infection control. The concept of germs remained unknown, and the practice of cleaning instruments between uses was inconsistent at best. These contaminated tools served as vectors for the transmission of diseases including tetanus, sepsis, and various bacterial infections that claimed countless lives throughout the medieval period. In contrast, executioners typically used their instruments on individuals who were already condemned to die, limiting their potential to spread disease to the broader population. Bloodletting emerged as perhaps the most dangerous procedure regularly performed by medieval barbers. This practice, based on the erroneous belief that removing blood would restore the balance of humors and cure various ailments, was applied to treat everything from headaches to pneumonia. Patients subjected to bloodletting often suffered from severe anemia, weakened immune systems, and increased susceptibility to infections. The procedure itself carried risks of excessive blood loss, contamination from unsanitary instruments, and the introduction of harmful bacteria into the bloodstream. Historical records suggest that bloodletting may have contributed to more deaths during the medieval period than warfare, making barbers indirect agents of mass mortality. The surgical procedures performed by medieval barbers extended beyond bloodletting to include tooth extraction, wound treatment, amputation, and even primitive forms of brain surgery. These operations were conducted without anesthesia, proper sterilization, or adequate understanding of human anatomy. The mortality rate for surgical procedures performed by barbers was extraordinarily high, with many patients dying from shock, blood loss, or post-operative infections. The lack of antiseptic practices meant that even minor procedures could result in fatal complications, transforming routine medical care into a potentially lethal encounter. Medieval barbers also played a significant role in the treatment of plague and other epidemic diseases that periodically devastated European populations. During outbreaks of bubonic plague, typhus, and other contagious diseases, barbers attempted various treatments, including the lancing of buboes, bloodletting, and the application of poultices and ointments. These interventions not only failed to cure patients, but often accelerated the spread of disease by creating open wounds and facilitating the transmission of infectious agents. The close physical contact required for these treatments placed both barbers and their subsequent patients at increased risk of infection, creating chains of transmission that extended far beyond the original cases. The educational background of medieval barbers further contributed to their dangerousness. Unlike modern medical professionals who undergo extensive training in anatomy, physiology, and disease processes, medieval barbers typically learned their trade through apprenticeship systems that perpetuated incorrect medical theories and dangerous practices. The transmission of knowledge occurred primarily through oral tradition and practical demonstration, without the benefit of scientific inquiry or systematic study. This educational framework ensured that harmful practices were not only maintained, but refined and passed down through generations of practitioners. The social status and accessibility of barbers created additional opportunities for harm. While executioners operated within the formal structures of the legal system and performed their duties only when officially sanctioned, barbers maintained shops and practices that were readily accessible to anyone seeking their services. This accessibility meant that individuals with minor ailments or cosmetic concerns could easily find themselves subjected to dangerous medical procedures. The trusted position that barbers held in their communities encouraged people to seek their services for a wide range of conditions, often with fatal consequences. The economic incentives faced by medieval barbers also contributed to their dangerous nature. Unlike executioners who were typically employed by governmental authorities and received regular compensation, barbers operated as independent practitioners who depended on patient fees for their livelihood. This economic pressure encouraged the performance of unnecessary procedures and the promise of cures for incurable conditions. Barbers had financial motivations to convince patients that they required treatment, leading to the subjection of healthy individuals to dangerous procedures that placed them at risk of injury, infection, and death. The cumulative impact of medieval barber practices on population mortality becomes evident when examining demographic data from the period. While executions represented a relatively small number of deaths compared to the overall population, the medical interventions performed by barbers affected a much larger segment of society. Every individual who sought treatment from a barber faced potential exposure to contaminated instruments, harmful procedures, and ineffective treatments. The widespread nature of these risks meant that barbers contributed to mortality rates on a scale that far exceeded the impact of executions. The geographic distribution of barbers versus executioners also demonstrates the greater threat posed by the former group. While executioners were typically concentrated in major population centers and operated only when legal proceedings demanded their services, barbers could be found in virtually every community throughout medieval Europe. This widespread presence meant that rural populations, who might never encounter an executioner, regularly interacted with barbers and faced the associated health risks. The ubiquity of barber services ensured that their dangerous practices affected populations across all social classes and geographic regions. The specific medical procedures performed by medieval barbers reveal the extent to which their practices exceeded executioners in terms of potential harm to society. Tooth extraction, one of the most common services provided by barbers, involved the use of crude pliers and forceps to remove infected or damaged teeth. Without the benefit of anesthesia or proper sterilization, these procedures were excruciatingly painful and frequently resulted in severe complications. Patients often suffered from excessive bleeding, jaw fractures, infections that spread to the brain, and sepsis that proved fatal. The primitive nature of dental instruments meant that extractions often removed not only the targeted tooth, but also surrounding tissue and bone, creating wounds that were slow to heal and prone to infection. Trepanation, the practice of drilling holes in the skull to relieve pressure or treat head injuries, represents perhaps the most extreme example of dangerous procedures performed by medieval barbers. This surgical intervention based on the mistaken belief that mental illness and head trauma could be cured by releasing evil spirits or excess humors, involved the use of crude, drilling instruments to penetrate the skull. The mortality rate for trepanation was extraordinarily high, with most patients dying from brain damage, infection, or hemorrhaging. Archaeological evidence from medieval burial sites reveals numerous skulls with evidence of trepanation, many showing signs that the patients died shortly after the procedure. The treatment of wounds and injuries by medieval barbers often proved more dangerous than the original trauma. Standard wound care practices included the application of various poultices, ointments, and binding materials that frequently introduced harmful bacteria into the injury site. The use of animal dung, urine, and other organic materials as wound dressings, based on the belief in their healing properties, created ideal conditions for infection. Many patients who might have recovered from their initial injuries succumbed to secondary infections introduced through these misguided treatment methods. Medieval barbers also performed primitive forms of cataract surgery, attempting to restore sight by pushing the clouded lens away from the pupil using sharp instruments inserted into the eye. This procedure, known as couching, had a high rate of complications including complete blindness, eye infections, and damage to surrounding structures. The lack of understanding regarding eye anatomy and the absence of proper surgical techniques meant that most patients subjected to couching experienced worse vision problems than before treatment, if they survived the procedure at all. The treatment of hernias by medieval barbers involved crude surgical techniques that often resulted in more harm than benefit. Barbers attempted to repair hernias by cutting into the abdominal wall and repositioning internal organs using their hands and primitive instruments. Without knowledge of sterile technique or proper anatomical understanding, these procedures frequently caused internal bleeding, organ damage, and fatal infections. Many patients who sought treatment for relatively minor hernias died from complications arising from the surgical intervention. Obstetric care provided by medieval barbers during difficult childbirths represented another significant source of danger. When summoned to assist with complicated deliveries, barbers often resorted to forceful extraction methods that caused severe trauma to both mother and child. The use of hooks, forceps, and other instruments to remove infants from the womb frequently resulted in uterine ruptures, excessive bleeding, and fatal infections. The mortality rates for both mothers and infants increased dramatically when barbers became involved in childbirth, compared to deliveries attended by experienced midwives. The amputation procedures performed by medieval barbers, while sometimes necessary to prevent the spread of gangrene or infection, were conducted under conditions that maximized the risk of complications. Amputations were performed without anesthesia, using saws and knives that had not been properly sterilized. Patients faced the dual threats of death from shock during the procedure and subsequent fatal infections. The lack of understanding regarding proper tourniquet application meant that many patients bled to death during or immediately after amputation procedures. Medieval barbers frequently attempted to treat internal ailments through external interventions that proved both ineffective and dangerous. The practice of applying hot irons or caustic substances to the skin to treat internal diseases caused severe burns and scarring while providing no therapeutic benefit. These treatments, based on the flawed theory that external heat could rebalance internal humors, often resulted in secondary infections and prolonged suffering for patients. The preparation and administration of medicinal compounds by medieval barbers presented additional risks to patient safety. Barbers routinely prepared and prescribed various herbal remedies, tonics, and purgatives without adequate knowledge of dosages or drug interactions. Many of these preparations contained toxic substances including mercury, lead, and arsenic, which were believed to possess healing properties. Patients frequently suffered from heavy metal poisoning, organ damage, and death as a result of consuming these dangerous remedies. The diagnosis and treatment of mental illness by medieval barbers reflected the period's profound misunderstanding of psychological conditions. Barbers attributed mental health problems to physical imbalances and attempted to cure them through bloodletting, purging, and other physical interventions. Patients suffering from conditions such as depression, anxiety, or epilepsy were often subjected to brutal treatments that worsened their conditions and sometimes proved fatal. The failure to recognize mental illness as distinct from physical ailments led to the application of inappropriate and dangerous treatments. The treatment of sexually transmitted diseases by medieval barbers involved the use of mercury-based compounds and other toxic substances that often proved more harmful than the original infection. The application of mercury ointments to genital areas caused severe chemical burns, while the ingestion of mercury-containing medicines resulted in systemic poisoning. Many patients seeking treatment for syphilis and other venereal diseases died from mercury poisoning rather than from the underlying infection. Medieval barbers also performed eye surgeries beyond cataract removal, including attempts to treat various eye conditions through crude surgical interventions. The removal of foreign objects from the eye, treatment of eye tumors, and correction of eyelid deformities were attempted using sharp instruments and primitive techniques. The delicate nature of eye structures meant that these procedures frequently resulted in permanent vision loss, infections, and disfigurement. The management of broken bones and dislocations by medieval barbers often resulted in permanent disability or death. Without understanding of proper bone-setting techniques or the importance of maintaining bone alignment during healing, barbers frequently created malunions that left patients with severe deformities and chronic pain. The use of crude splints and binding materials sometimes restricted blood circulation, leading to gangrene and the need for amputation. The treatment of skin conditions and tumors by medieval barbers involved the use of caustic substances and crude surgical excision techniques that often spread cancerous conditions or created severe scarring. The inability to distinguish between benign and malignant growths meant that barbers sometimes removed healthy tissue while leaving cancerous cells behind. The lack of proper wound care following these procedures frequently resulted in infections that proved more dangerous than the original skin condition. The statistical analysis of mortality attributed to medieval barbers versus executioners reveals the true scale of the threat posed by these seemingly benign practitioners. Historical records from various European cities during the medieval period indicate that while executioners typically performed between 10 to 50 executions per year in major population centers, individual barbers routinely treated hundreds or thousands of patients annually. When the mortality rates associated with common barber procedures are applied to these patient volumes, the resulting death toll far exceeds the number of individuals executed by official means. Contemporary accounts from medieval chronicles and medical treatises provide numerous examples of the deadly consequences of barber interventions. The Chronicle of Matthew Paris describes several instances where noble families lost multiple members following treatment by barbers, including cases where entire households succumbed to infections introduced through bloodletting procedures. Similarly, the medical writings of medieval physicians, such as Albertus Magnus, contain warnings about the dangerous practices of barbers and their tendency to worsen rather than cure ailments. The plague outbreaks of the 14th century provide a particularly stark example of how barbers contributed to mortality on a scale that dwarfed the impact of executioners. During the Black Death, barbers attempted to treat plague symptoms through various interventions, including the lancing of buboes, extensive bloodletting, and the application of poultices containing toxic substances. These treatments not only failed to cure patients, but often accelerated their deaths, while simultaneously increasing the risk of transmission to other community members. Historical estimates suggest that inappropriate medical interventions, many performed by barbers, may have increased plague mortality by 10 to 20% in affected areas. The social acceptance and trust placed in medieval barbers created a unique form of danger that executioners could never replicate. While the general population viewed executioners with fear and avoided contact whenever possible, barbers were welcomed into homes, trusted with the care of children, and consulted on matters of health by all social classes. This trust provided barbers with access to victims who willingly subjected themselves to dangerous procedures, believing they were receiving beneficial treatment. The voluntary nature of these encounters meant that barbers could cause harm on a massive scale without arousing the suspicion or resistance that would have limited an executioner's activities. The economic structure of medieval barbering created incentives for the performance of unnecessary and dangerous procedures that had no parallel in the work of executioners. Barbers earned money based on the number and complexity of procedures they performed, encouraging them to convince healthy individuals that they required treatment. This economic model led to the creation of artificial demand for dangerous services, with barbers actively seeking opportunities to subject the population to harmful interventions. Executioners, by contrast, only performed their duties when commanded by legal authorities and had no financial incentive to increase the number of individuals they executed. The geographical reach of barber-related mortality exceeded that of executions by several orders of magnitude. While executioners operated primarily in major cities and administrative centers, barbers could be found in virtually every settlement throughout medieval Europe. Rural populations, who might live their entire lives without witnessing an execution, regularly interacted with barbers and faced the associated health risks. This widespread distribution of dangerous practitioners ensured that no segment of society remained safe from the threat posed by medieval medical practices. The intergenerational impact of barber practices further amplifies their danger relative to executioners. Families who trusted barbers with their health care often saw multiple generations suffer from the consequences of these relationships. Children raised in households where barber services were regularly utilized learned to trust these practitioners and continued the cycle of dangerous medical care into adulthood. This perpetuation of harmful practices across generations created cumulative mortality effects that far exceeded the immediate impact of executions. The documentation of specific cases reveals the horrifying scale of individual tragedies caused by medieval barbers. The records of St. Bartholomew's Hospital in London describe numerous instances where patients admitted for minor ailments died following treatment by barbers. One documented case from 1347 describes a young merchant who sought treatment for a minor cut and died within days after a barber applied a poultice containing mercury and lead compounds. Another account tells of a family of 6 who all perished after receiving bloodletting treatments from the same barber during an outbreak of fever. The training and regulation of medieval barbers contributed significantly to their dangerousness. Unlike executioners, who were typically selected and trained by governmental authorities with an interest in ensuring competent performance, barbers learned their trade through informal apprenticeship systems that lacked standardization or oversight. This educational approach allowed harmful practices to proliferate and persist across generations of practitioners. The absence of licensing requirements or professional standards meant that anyone could establish themselves as a barber and begin performing dangerous medical procedures on an unsuspecting public. The tools and techniques employed by medieval barbers evolved slowly and often in directions that increased rather than decreased their dangerousness. The development of more sophisticated bloodletting devices, for example, allowed barbers to extract larger quantities of blood more efficiently, increasing the risk of fatal blood loss. Similarly, advances in surgical instruments often focused on enabling more invasive procedures rather than improving safety outcomes. This technological progression, driven by the desire to expand the scope of barber services rather than improve patient outcomes, created increasingly dangerous environments for medical care. The cultural and religious factors that influenced medieval medical practice further enhanced the danger posed by barbers. The Christian doctrine that physical suffering was spiritually beneficial led to the acceptance and even encouragement of painful and harmful medical procedures. Barbers exploited these beliefs by promoting treatments that caused severe pain as evidence of their effectiveness. The religious prohibition on anatomical study also prevented barbers from developing accurate understanding of human physiology, ensuring that their interventions remained based on flawed theoretical foundations. The legal framework governing medieval medical practice provided little protection for patients harmed by barber procedures. Unlike executioners, whose actions were subject to legal oversight and could be challenged through established judicial processes, barbers operated with minimal regulation or accountability. Patients who died or suffered harm from barber treatments had little legal recourse, and barbers rarely faced consequences for their failures. This lack of accountability created an environment where dangerous practices could persist and proliferate without deterrent effects. The comparative analysis of executioner versus barber mortality ultimately reveals a profound paradox in medieval society. While executioners, whose explicit purpose was to end life, operated within controlled legal frameworks with limited impact on overall population mortality, barbers, whose stated mission was to preserve and restore health, caused death and suffering on a massive scale. This paradox highlights the critical importance of medical knowledge, proper training, and regulatory oversight in healthcare delivery. The medieval period's lack of these essential elements transformed healing practitioners into agents of destruction whose impact exceeded that of official instruments of death. The legacy of medieval barber practices serves as a sobering reminder of the potential consequences when medical intervention occurs without adequate scientific foundation, proper training, or regulatory oversight. The thousands of individuals who died under the care of medieval barbers represent victims of good intentions implemented through dangerous ignorance, a phenomenon that continues to pose risks in various forms throughout human history.